Hi, I'm Dr. Kash, and this is Dr. Kash Medical and Life. And today I'd like to answer a question that you're here to seek because you're in pain or your loved one is in pain and you want to either help yourself or your loved one, a wife, spouse, husband, a child. And that the question is, what is a home remedy treatment for acute attack of gouty arthritis? Now, there are many type of treatments that I'm sure if you are looking on YouTube or on Google, wherever, there will be hundreds and hundreds of suggestions. But today, I'm going to share with you one, just one, okay? And this is the one that I can attest to that it worked because I have tried on myself. I have gout for the last 25 years and I've been dealing with it. I've taken all kinds of medications, allopurinol, uric, indomethacin, prednisone, a whole bunch of other medications. And those medications have their own places in the setting of treatment of acute arthritis or preventive of gouty arthritis. But today I'm going to go ahead and talk about one natural way of doing it and see if it helps you. Now, when we hear the word natural, it makes us feel good because we know we're not taking a whole bunch of chemicals and such. Okay, I'm saying this, I'm not opposed to conventional treatment such as medication that is prescribed by a doctor. I'm a doctor myself, and I do take medication myself for the acute flare-up of gouty arthritis. But I also at the same time understand the worries that people have. And I do have my own concern about taking too frequently taking too much of the steroid like prednisone or too much of an NSAID like indomethacin or colchicine or the prolonged exposure of medications such as allopurinol or uric or prednisone or any of those medications for gout. I'm very well aware of those. That's why, as much as I can, I try to minimize the use of those medications and find ways to deal with them naturally as well. And therefore, today, that's why we'll be talking about this one particular technique, okay? Now, I actually discovered this about 2 years ago. I have a medical condition that required for me to do a colonoscopy, okay? And so when I saw the GI doc, and the GI doc said, hey, you gotta take this prep. So I came home with a whole couple of bottles of prep, colon prep, okay? And that night, I started to drink and follow all the directions. And I'm like, oh shit, my big toe is swollen and painful and red. And I'm like, oh, holy crap. I'll be running to the bathroom all night and it's gonna be painful and having to take those repeated trips. So I was all worried. And sure enough, throughout the night, I did spend a lot of time running back and forth to spend some time, a lot of time with Mr. Toilet, okay? And by morning, I'm all clean out. All clean out, okay? And then I realized something. Holy shit, this is different. My toe is not hurting anymore, And I looked, the redness is gone. I would say 98% of the pain is gone. Swelling is gone. And I feel much better. I'm up, I'm walking. I'm telling my wife, oh yeah, I feel pretty darn good. Let's go ahead and go get this colonoscopy done. Okay? And sure, went, had the procedure done, everything's fine. and I realized, I think I just found a way to treat my gout naturally when I do have an acute attack, okay? And that is to flush things out. And so I thought about it, I was like, I could name this Dr. Kash Uric Acid Flash, where the idea is to flush out the uric acid. Now we know that gout is caused by, in general, it's caused by an elevated level of uric acid in your body. Therefore, once you reach a certain concentration, it will then crystallize and deposit in your joint, and as a result of that, cause a lot of inflammation, and that then led to all the swelling and the pain and all of those things, which can be discussed in a separate topic, but that's the idea. And how the body is going to process and get better is going to get all the inflammation off, okay? And that means having to lower the uric acid. And so I thought, okay, well, there are two ways mainly of getting rid of uric acid from the body. One is through the kidney, okay? About 2/3 of the body's uric acid is filtered through the kidneys, 2/3. And then the other third is going to be excreted or removed from the gut, from the GI tract, from pooping. And so the kidneys, I don't really have any control over it. But the gut, yes, I can do something to force things out, or whatever you call it, detox. And so the idea is then to flush things out. You know, so I thought about it, I'm like, not every time that I have an acute attack, I'm gonna go and grab a whole gallons of make citrate and stuff down in that, and yeah, probably not gonna be the healthiest. So I wanna do it naturally. Therefore, I use prune juice. Prune juice is something that you could just pick up at the grocery store, super cheap and natural. And I have prescribed prune juice in the acute setting of mild constipation to a lot of my patients who comes and get hospitalized. I prescribe prune juice. A lot of times they do help. So in this setting, I have tried out different times, and I found that, at least for me, 16 ounce, this is the formula. 16 ounce of prune juice, gulp it down, followed by anywhere from 24 to 32 ounces of water. Now, prune juice itself may cause you to have a bowel movement. And if you just had a regular bowel movement, probably doesn't work that well in this setting. But the idea is to flush it out, okay? That's the idea. You got to remember that 1/3 of your uric acid is going to flush out through the, be excreted through the gut. If you flush it out by the process of either osmosis or diffusion, you know, if you lower the concentration in the guts of the uric acid, the body's going to force some of those uric acid in your bloodstream into the lumen of the gut and flushes things out. So again, to lower the concentration of uric acid. And I found that to be about 95% effective, I would say, at least 95% of the time. Where if I have an acute attack, I would drink 16 ounces of prune juice, flush it, follow with water, and that usually cause a lot of trips to be with Mr. Toilet. Just basically a lot of diarrhea flushes things out. And by the time you're done, your colon pretty much is cleaned. And again, usually that takes care of the acute pain and the flare up. And then you still need to maintain and whatever is triggering it, avoiding those trigger factors. And also, if you need to take medication to maintain, you do need to continue those. Okay. Now, someone will probably ask, is it healthy to be flushing things all the time? And I would say no. It's not. It's not going to be good to be having diarrhea or having that kind of detox every week or so. Once in a while. I'm talking about once in a while. When you do have an acute flare, then you do that, flushings out, and get rid of the pain. You can go on with life, enjoy whatever you're doing at that time. Okay, but it's definitely not recommended to do this very often. And also depending on your any medical conditions that you may have, that can be affected by significant shift in fluid from your body, whether if you have any kidney dysfunctions or if you're elderly and you're not going to be able to tolerate a loss of a significant amount of fluid shift. And if you do get a little bit dehydrated, you're not going to be able to medically tolerate that, then certainly this is not recommended for you. What I am explaining is for someone who is relatively healthy, doesn't have any problem with fluid balance, and you can take in a whole bunch of fluid and you'll be fine, you'll pee it out, or you can also have it flush out with the prune juice, and by the end of the day, your gout is gone and you'll be okay. Now, once in a while, if I have to do 1 or 2 treatments and I feel like, yeah, shoot, I'm flushing out a whole bunch of poop, and if I feel like a little bit dehydrated, I feel like, maybe because of all those diarrhea, could be losing potassium, your calcium, your magnesium, some of the critical electrolytes. Then when I pick up my prune juice, I would also pick up a little bottle of Pedialyte, and it's super cheap, a couple of bucks with the prune juice. And when I'm done with the treatment, flush out with the water, and the diarrhea stopped, then I would just drink the Pedialyte to replenish the potassium, your calciums, your sodium, all those goodies to hopefully maintain everything. Now, I haven't done like a study to make sure that that's happening or so on and so forth, but it just makes sense. After you suffer a bout of diarrhea, I just recommend some electrolytes. When I have a pediatric patient that also have some diarrhea, what do? I recommend some Pedialyte to the parents, and to keep the child replenished until he or she fully recover. Same idea. Okay, so I hope that if you find yourself having to take a lot of pills, whether it be indomethacin, whether it be colchicine, whether it be prednisone, and you just want to try something different, something more natural, prune juice flushes, it worked for me. Okay, those medication do still have their own values, and in the appropriate setting, definitely still the conventional, the to-go-to way of treatment. But if you want to do naturally, you can try the prune juice flushes as I have described. Now, if you find that cherry juice or celery or turmeric or any of the many suggestions out there on the YouTube universe or on Google to be helpful for you, then I thank God for that. As you found something that is natural, that is helpful for you. Okay. But at least for myself, the prune juice worked for me. Okay. Now, if you're a patient and you are suffering right now, you want to try, I think it's reasonable. Certainly, I'm not your doctor. I cannot make a recommendation for you, you want to check with your doctor, but only your doctor can make a recommendation for you in the acute setting of treatment of flare up. But I personally have tried it and just want to share with you. If you are a healthcare provider and you stuck along this long and you have some suggestions that may help our viewers, please put it in the comment. If you're a patient, if you've tried it, or if you've tried something else that has worked for you, put it in the comment section. Be respectful, be mindful of others, people's suffering, and also be helpful. So I hope that this helped. If you have not subscribed to my channel, if you find this information to be helpful, to be useful, please do consider subscribing. And I hope I'll see you next time. Stay happy, stay healthy. See you soon. Bye.